There is no question. Right. So if you have read and understood, considering it history-taking station, kindly please begin.
Hello, I'm Dr. Kamadun Ibrahim, one of the candidates for this exam. Please, may I confirm your name and your age, please?
I'm John, 64 years old.
Oh, how would you like me to address you, please?
I have an abdominal pain. Tummy.
How would you like me to address you? What would you like me to call you?
Well, call me John.
John. Okay, John, nice meeting you today. Please, can you tell me why you are here today, please?
I have a pain in my tummy. I noticed a blood in my stool.
Oh, so sorry about that, John. Please, can you tell me more about this blood in your stool?
Actually, I started noticing this 6 months back. But in the last 2 days, it became more.
Yes. That must have been difficult for you, Joe. Sorry to hear that. Okay, so to find out what this could be, I'll need to ask some few questions. Is that okay? Can I go ahead, please?
Yes, yes.
Okay, John. So please, this bleeding, does it start suddenly or it was gradual?
No, it started gradually.
Okay, is it fresh blood or altered blood?
Yes, lately it became, I could recognize.
You said what?
Lately, yes, it's fresh blood.
Oh, all right, John. So this blood, does it come with your stool or comes before your stool or comes after your stool?
Actually, it becomes now it's coming even without stool. I found the blood in my underwear.
Oh, so sorry to hear that. Oh, okay, John. If I heard you clearly, you said you have pain in your tummy as well.
Yes.
All right. Which parts of your tummy is actually painful?
I think it's my whole tummy. But not particular part.
Okay. If you had to grade this on the scale of 1 to 10, what will you grade it?
Maybe 6.
Oh, that's not even distressful. Do you mind if I offer you a painkiller?
No, I'm okay now. Thank you.
All right, so we can go ahead, right?
Yes.
Okay. Do you notice any fever of late?
Sometimes at night.
Okay. How is your appetite like?
No, it's diminished. It's since maybe 3 months.
Oh, okay. Are you losing weight at all?
Actually, yes. Everyone is telling me this.
Oh, that must have been difficult for you.
Mm.
Oh, okay. Could you tell me whether you travel out of the country recently?
I didn't understand. What?
If you travel
You said what?
abroad.
Yes.
recently.
And do you
No,
travel
no,
out of? Did you
no,
travel
no,
abroad recently?
no, I didn't yet.
All right. Did you have injury to your tummy for this onset?
Not as I recall, no.
Okay. Do you see like slime tissue in your back passage when you go to toilet?
No.
Okay. Okay. So can you tell me what you think this problem could be? What do you think is the cause of all this?
I'm afraid it could be cancer.
Or that's too early to say, Joan. We still need to ask some more few questions and do some investigations before we could tell. Is that okay?
Yes.
What would you like us to do for you?
I want you to find out the cause of this.
Okay, we'll definitely try our best, Joan. Okay, so
Yeah.
do you see your GP for any medical condition, please?
Yes, I have a high blood pressure, but now it's
All
good.
right. Are you on the medication?
Yes, I'm taking medication and I'm good.
So that's fine. I'm happy to hear that. Do you have any allergy?
No.
All right. Is there anyone in your family that has something similar to this? Similar condition?
Yes, my father died of colon cancer. That's why I'm concerned.
Oh, sorry about that, Joe. Sorry.
Okay, can you please
Okay.
summarize your
Oh,
history
so,
taking now?
I've interacted with Joan, 64-year-old man who complained of 6 month history of bleeding parectum with associated pronounced abdominal pain and constipation of 3 days duration. He has no history of travel abroad. There is associated passage of mucoid stool. There's an associated history of fever, loss of appetite, and weight loss.
Okay, so what are your
He's
provisional?
a non-hypertensive patient, and yeah, my program to complete my history, I would like to ask social history and ask some systemic review.
Very
My
good.
program diagnosis would be hello,
Yes.
colorectal cancer,
Yes.
inflammatory bowel disease, irritable bowel syndrome. Then
Okay. Can you please tell me what investigations would you carry out to confirm your diagnosis?
I want to do colonoscopy.
Yes.
With biopsy. To do complete blood count, ENU, total blood gas, C-reactive protein, ESR, liver function test. I want to do abdominal ultrasound, chest X-ray.
Anything else which is more important?
Barium enema.
Okay. Stool culture maybe.
Stool culture.
Did you mention?
Culture.
Okay, and hematology, they say LFTs and urea creatinine, urea and electrolytes.
Yeah, I mentioned those ones.
Yes. And maybe mesenteric angiography if they want to rule out, or CT if they want to
CT
rule out.
angiography?
Yeah.
Okay, ma'am. Okay.
Or maybe simple abdominal X-ray if they want to rule out any obstruction, toxic megacolon, any inflammatory bowel disease or anything. So yeah, to keep it simple. All right, very good. This station basically is about 2 things, and you have to take history of 2 things in 6 minutes, which is very impossible. So you tried your best to cover both of those 2 factors, like abdominal pain and bleeding PR, but definitely it was too huge. It was too broad for you to cover. So a lot of the things got left behind. Just say that if you asked about the pain, so in order to assess or evaluate the severity, you could have asked about the grading, that if you grade from 1 to 6, maybe she said 6, right? You did ask, right?
Yes, she says yes. She says 6.
Yes, she said 6. So that you asked. But when you were asking about the bleeding PR, so you could have asked how much is it? Is it like a streak, or is it half teaspoon, or is it like half a cup, or like you had to ask about the amount. And is it every time this much? How many times do you go to, or do you notice that it's bleeding, and just to evaluate how much or how frequently patient is bleeding per rectum, right? And then duration you asked, was it just the blood, or was it mixed with the poo, or does it come after poo, or before poo, or mixed, or so you had to ask the little in details. And if you could ask if patient has noticed any change in bowel habits, has it become more smelly, or is there this like phlegm or discharge with it? So you have to ask those as well. Any any symptoms of other upper GIT symptoms, like feeling nauseous, or chest burn, or any difficulty of swallowing, or if there is any what is called history of tiredness, right? And then with the pain or with the bleeding, was it just the bleeding PR, or was it associated with pruritus ani as well? So like there could have been a lot of more questions, but you tried your best to cover the most, so that you could tell me the differential diagnosis that you're telling me. Good. And
Thank you, ma'am.
best thing was that the things that you couldn't ask, you told me that if time would have allowed you, you will ask those, so that gives you mark. So it's good effort. Good. Excellent.